Pacing to prevent and control post-exertional malaise is probably the single most important and effective intervention in managing this illness. And it has to be done pretty much by you. All right, the third category in the research clinical intuition model. Remember, the first is to make sure that you identify and treat all other medical conditions. And this is something you do at the beginning and at intervals anytime the question comes back up. Next is to master how to pace your activity so that you can reduce the severity and duration of post-exertional malaise. And we supported that up with gene expression. And the third aspect is to address the major aspects of illness supportively. Because if your symptoms spiral out of control, it's difficult to even know where your primary problem is. So really good management of the symptoms of illness plays an important role in quality of life and symptoms, but it puts you in a much better position to heal, to participate in research, and possibly to respond to primary treatment. So let's talk about each one of these. And before we talk about them individually, I want to go back to our diagram, and I want to highlight in colors these different aspects. So this slide has highlighted all the aspects of illness. Oh, you know what? I forgot to say something when I put this slide up. On the right here is a column that lists the research findings that match with the clinical presentation of illness. Sorry, I forgot to do that in the first slide. So we talked about all the areas that the illness presents in. And then over here, the research is listed, and we're going to go through it in a highlighted way. So this first slide shows all the aspects of illness in purple that relate to cognitive and mood symptoms. And you can see how many there are. And then there's also some over here in the research list of findings in the HPA axis, a lot of studies of the brain and neurocognitive tests. This view shows how symptoms might relate to the autonomic nervous system, orthostatic intolerance, and circulation. So there's a role played by the HPA axis, your circulatory system. It's manifest in your gastrointestinal tract. I didn't put all the CNS symptoms, but I really believe that the autonomic nervous system plays a role. It can be measured with tilt table testing, cardiopulmonary testing, all the blood flow studies, and neurocognitive tests. The third slice through is pain. And remember, we're going to talk about how do we attack each of these symptoms and what would be the rationale in treating symptoms. So this slide shows, basically illustrates pain. And with this illness, there's altered sensory perception that affects the musculoskeletal system, the gastrointestinal tract, and to a degree, some of the symptoms, even the immune symptoms like sore throat, can be amplified pain symptoms. And we know that there's a science behind this as well. That there's a very, very large science of fibromyalgia that I didn't put on here with imaging of the brain and spinal fluid. And the last one I wanted to put in sort of highlighting it on this diagram that we use is sleep. And you can see why we would want that sleep is a primary part of the central nervous system issues. It may relate to the HPA axis. And a little bit of the data supporting the HPA axis, but it can also be disrupted by pain and by mood symptoms and cognitive symptoms, so they all interrelate. So this is what it looks like when someone comes into my clinic. And this is the way I try to gather a little bit of history, a pain diagram, and then patients will rank their symptoms on a 0 to 10 scale, with 10 being the most serious. And you can see that when someone comes into the clinic, all the symptoms cluster together, a little bit different for each person. But how do we tease out, just where to begin in management? So let's start with the mental health and cognitive. And we're going to go through each just a little bit. This, again, could be an entire talk. And we know that ME/CFS is not a mental health disorder, but we also know that mental health concerns commonly impact people with this illness, because there's a huge psychological impact of severe chronic illness. So it makes sense that we work to reduce the grief response, to calm the fears around the illness, and and reduce powerlessness. And each of you can find a way in your own life to seek insight, courage, balance, optimism, surround yourself with safety and support so that the psychological impact of the illness is less devastating. Because the psychological impact of illness impacts your brain. And think of all the systems that are seated in the brain. So the support that can be given psychologically is tremendous. I put a word here also about cognitive impairment. This is sort of a little bit about the psychological impact, but there's also an important cognitive aspect to this illness that's independent of the psychology of the illness. And I just want to say that I think the mental fatigue of this illness is a little bit, the cognitive impairment is I think of as a mental fatigue that responds in parallel to the physical fatigue. And it also responds to the same supportive care that we're going to talk about: pacing, sleep, treating orthostatic intolerance, trying to exercise your brain without causing too much post-exertional malaise, and being careful that you don't take so many medications to impair your cognition. And sometimes a light stimulant can be helpful for focus and concentration, but usually doesn't dramatically extend activity tolerance or prevent post-exertional malaise, so they need to be used with care. So let's take a look